Hey folks, it's Dr. Sam, and I'd like to welcome you to another eyeClarity podcast. We are at podcast 103, and I want to thank you for joining me today. We've got 5 questions that I'm going to be answering. Before I do that, I want to announce my upcoming September 12th online holistic vision care class. And this is a class that if you are frustrated with your current eye care, if you're concerned that your eyes just keep getting worse year after year, you go to your eye doctor and he or she keeps increasing the prescription and you're tired of that. Or let's say you just received a diagnosis of cataracts, glaucoma, macular degeneration, and you're worried about it, and the doctor says, well, there's really nothing you can do except surgery or drugs. Well, we know that's not true. Or you're on screen time. Some of my younger patients that are video gamers and they're spending 8, 10, 12, 14 hours a day on screen time, and it's beginning to affect their eyes, or they're concerned about the effects of blue light on not only their eye tissue and their eye health, but their sleep cycle and their overall wellness. This class is for you. So if you want to sign up, you can do so very easily through an Eventbrite link. Or you can go to my website, drsambyrne.com, click on online classes, and that will take you to my September 12th offering. Each class I do is very different. It's all based on what people's issues are and what they're bringing to the class. And, I'm not doing cookbook approaches, so every class is different. And we're going to be covering ways that you can improve your eyes and vision, eye wellness. I'm going to show you ways to work with light and color therapy, sound healing, aromatherapy, nutrition, and many other things. Now, if you can't make the class live, that's totally okay. It will be available for you for 30 days after the recording, and you can watch it as many times as you want to. Also, if you register for the class, you receive a discount on all my products, web store products. So take advantage of that. People are loving the products that I have out on my store right now. So anyways, I hope you can join us. It's a lot of fun. It's from 10 to 11 a.m. Mountain Standard Time, Saturday, September 12th. So I hope to see you there. And yes, okay. All right, well, let's start off with question number 1. This is a question regarding macular degeneration. Macular degeneration is one of the leading forms of blindness. More and more people are being diagnosed with it every day. And this particular question is related to our cholesterol levels, especially, remember the HDL reading that we talk about? The HDL is supposedly the good cholesterol. And this patient is asking about, is there a correlation between higher levels of HDL and the risk factor of developing macular degeneration? I'm so glad you asked that question, because there was a study that came out in 2018 in the Review of Optometry, where researchers studied over 30,000 participants who lived in Western Europe. And they showed that actually those people that had higher levels of the HDL, triglyceride level measurements, those that had higher levels did have a higher risk of developing age-related macular degeneration. Now, I think one of the issues, and this was brought out in the research study, is if you have high levels of HDL, you can develop something called drusen, which are the yellow fatty deposits that tend to accumulate in the retina, and if they get close to the macula, this can cause the beginning of macular degeneration. And so, it's very interesting when we talk about kind of a specific isolated factor as it relates to our eye health and macular health specifically, because there's so many things that you can do to neutralize the effects. Let's say you get a genetic test for macular degeneration. You find out, my goodness, I have a high level of a risk level. Or like in this case, the HDL levels being high correlated to macular degeneration. Or let's say you were a smoker. That's a high risk of macular degeneration. So there are many, many factors that come into play, and there's so many proactive things that you can do to reduce your risk. So number one, just in terms of the HDL levels and your overall cholesterol levels, let's just start there. More aerobic exercise. In fact, some studies say that if you can increase to about 75% of your maximum heart rate, this actually can help bring down cholesterol levels. Weight loss is another factor. Eating healthy fats like olive oil, avocado, walnuts, pecans, hazelnuts, so the nuts and seeds family. Increasing your soluble fiber, beans, lentils, peas. These are all helpful factors at perhaps balancing out your cholesterol levels. And last but not least, avoiding foods that contain trans fatty acids. Beyond that, some of the other proactive things that you can do, make sure you're getting 15 to 20 milligrams of lutein, 4 to 6 grams of milligrams of zeaxanthin daily, 12 milligrams of astaxanthin. You can either get that through a supplement, little commercial. My supplements have enough and are great for being proactive for macular health. Or you can eat the foods, the rainbow diet, the red, orange, yellow, green, vegetables, your berries for fruits, making sure you're getting enough probiotics in your diet, eating an anti-inflammatory diet, make sure you're getting vitamin A, and of course your trace mineral levels, selenium, chromium, magnesium, and the master antioxidant glutathione. Protect your eyes from the damaging blue light from all your screen time, so make sure you use blue blocking filters. I've got a few good ones that would work for you. And the eye exercises. So doing my eye exercises is another great way to be more inclusive, including all of your eye and not just the macula. Remember, the macula makes up 1% of the real estate of the retina, and it begins to get our attention when we start having macular problems. So there are loads of things that you can do as a proactive practice. And even though this particular study pointed to this risk factor, I think overall there are many things you can do to avoid macular degeneration. All right, let's go to question 2, and this comes from a listener, and she writes, what do you think of syntonic phototherapy? Is it helpful? If yes, can it be done at home? I came across a great practitioner, but it costs $15,000 to undergo vision therapy and syntonics. Okay, well, I want to give this to you for free. You don't have to spend $15,000. Syntonics is an organization I used to be in. I'm not in it anymore, so disclaimer there. I actually joined them in 1986, group of doctors who work with light frequencies. And it was invented by a guy named Dr. Harry Riley Spittler, who was an optometrist and also a physician, and he used light frequencies on his mental patients. Got great results, and he started the organization back in the mid 1930s. Let's just say that. I think that I'm not going to speak on the syntonic approach. My approach is very evolved from that, and that I now believe in what I've seen in my practice and in my workshops is I like to do something called the rainbow method. So I'm giving all the light frequencies one at a time, and where you can purchase these, you can go to a theatrical supply store and you can buy these sheets of the different colors. Now, the main visible colors you want to get are red, orange, yellow, green, blue, indigo, and violet. These are the main colors of the visible spectrum. And whenever you apply a color frequency to the retina, part of the light is stimulating the photoreceptors, those are part of the retinal cells, that allow us to see. And what I observed over 30 years of clinical research is one of the reasons why our retina becomes desensitized to light is because of visual stress, trauma, toxicity. This could be heavy metal toxicity, pesticides. So we develop a functional condition called visual suppression. That means the brain is shutting off one of the eyes. Now, unfortunately, in regular eye care management, there's no testing done for visual suppression. But visual suppression tells us about the functional aspects of how well our two eyes are working together. And again, if we're suffering any of the stress, trauma, toxicity, what begins to happen is the retina becomes desensitized to the light, and eventually the brain shuts off the eye to avoid double vision, confusion, and this is called visual suppression. So when you do the rainbow color, and you can buy these gels for $15 or $20, the way you do the treatment is day one, you do this for 30 days. So this is the 30-day challenge. Day one, you cover the left eye and you're doing the rainbow through the right eye. You want to make sure you're internalizing the colors by feeling, what do I feel? When I look at this color red, how does it make me feel? That will cue you to have your nervous system, your endocrine system, and your somatic body to say, okay, I'm taking this in, I'm internalizing this. You do it for 30 seconds to 2 minutes, then you go to the color orange, then yellow. So you go through subsequently the sequence of the colors with the right eye. Day 2, you do the same thing with the left eye. Day 3, you do both eyes. Day 4, you go back to the right eye again. So you're repeating this cycle. And each day, you're just introducing the color frequencies to the eyes in this rainbow method. Very easy. Very simple. You're going to start noticing after about a week that your eyes are seeing things more clearly. You have more resiliency in your eye focusing. You might start getting some skin discharge, so there might be some release going on. And you're going to notice when you do this for 30 days, your eyesight is going to come back. And you're going to see things more clearly. Your glasses may become too strong. And so you're going to need to reduce the prescription. And if you couple that with my eyeClarity program, so if you go to my eyeClarity eye exercise program, it's free. And you dial into whatever prescription or whatever eye condition you're dealing with. If it's glaucoma, do that one. If it's macular degeneration, do that one. If it's myopia, that's the exercise program you do. You couple the eye exercise program with this rainbow method, and you will totally improve your vision without having to spend $15,000. That's kind of exorbitant for me. Anyways, that's a way for you to be able to apply the color therapy and the vision therapy, and you can do it in an economic basis. So I want to thank you so much for the question. Really, really good. All right, let's go to question number 3. Dr. Byrne, there's much talk about nitric oxide, and it helps very much in circulation. That's true, it does. What foods are out there that I can eat to bring more nitric oxide to my eyes, my body, my circulation? Okay, so let's talk about nitric oxide. This is an ingredient that is in almost every cell of the body, and it acts like a vasodilator. So in other words, it's actually stimulating the muscles around the blood vessels to open up, to relax. Now, if we think of the eyes are a sea of blood vessels. And disease starts occurring in the eyes because those blood vessels are not producing enough oxygenation and hydration, and this leads to metabolic waste, free radical damage, oxidative stress, inflammation, you know the story. So foods that contain nitric oxide would be number one on my list is beets. And actually what's in beets converts to nitric oxide. Second would be garlic. That's another big one. Nuts and seeds actually are another great source of nitric oxide. And there's something in the nuts and seeds called arginine. And arginine actually helps increase nitric oxide levels. You know, there's supplements out there, especially if you have cardiovascular disease, that have arginine in it, and part of the strategy is to increase the nitric oxide. And so some other foods would be cacao. I just did a great video blog when I was in Hawaii in January on the benefits of cacao, and nitric oxide is another benefit. Leafy green vegetables, citrus fruits, so limes, lemons, grapefruits, all contain nitric oxide. And then my favorite one, pomegranates. Yes, containing nitric oxide. So yes, nitric oxide is something that can be very helpful. If you've got conditions like glaucoma, macular degeneration, any retinopathies, nitric oxide is a total winner. And there is research out there that is showing that arginine does help in the production of nitric oxide, which then in turn helps the blood vessels. So that's a great question. I want to thank you so much. All right, question 4. Let's go to implanted contact lenses. I've had these since 2010. Now I'm developing cataracts and high eye pressure. All right, so whether you're doing implanted contact lenses, LASIK surgery, these are external solutions for an internal problem. So whenever you do an external solution, you're going to have mild success, but there's always side effects. And although for implanted contact lenses, that is a better option than saying LASIK surgery if you've got moderate to high amounts of myopia, there's still side effects. And some of those side effects can include things like double vision, eye strain, red eyes, even more incidents of glaucoma and cataracts. So instead of doing ICLs, my suggestion would be do my eye exercise program. Healing your eyes is an inside job, inside out, meaning that if you can really become aware of the programming behind your eyes, what has caused your eyes to change, then you have a great chance of improving your vision. And the key is developing a practice of self-regulation. And if you can regulate your reactions and reduce your eye stress, increase your eye nutrients, do the eye exercises, to me, that's a much better approach than doing anything like LASIK surgery or intraocular implanted contact lenses. Remember, those are symptom approaches. And whenever you treat the symptom, you're driving the causes further in. And, you know, I'm really into trying to find the cause. And if I can figure out what the cause is, the symptoms go away. Okay, last question. This is a question about eye muscles, specifically superior oblique muscles, which is part of the eye muscle that attaches to the eyeball, and it causes the eye to torque or turn. It's kind of up in this area here. And this is myokymia, which is a type of paralysis in the superior oblique muscle, which can lead to double vision and eye strain. And, you know, when your two eyes don't work together, it wreaks havoc. So in this particular syndrome, I kind of look at the bigger picture, which is, first of all, what's our inflammation level in the eye and also muscularly? So adding trace minerals like magnesium, selenium, chromium, eating an anti-inflammatory diet, increasing your fats and oils, these are no-brainers. Second of all, if you've had any kind of head trauma, I would definitely do some craniosacral therapy on you. Cranial work is really effective for eye muscle imbalances. And, there's a nerve issue going on here. We call it cranial nerve 4, which is the trochlear nerve. And there could be an inflammation, there could be some damage, there could be, again, from trauma. We don't know. But doing cranial work is a natural, organic way to start to reconnect the eye muscle to the nerve in a healthier way. The eye exercises are fabulous for any eye muscle disorder, and doing those exercises give your eye muscles and eye nerves more freedom in movement, more versatility, more resiliency, and you learn how to direct and control the eye muscles better. And doing it through a physical therapy approach is so much better, more effective than things like eye muscle surgery. So you got to do a little detective work here, but once you figure it out, there are many different ways to the top of the mountain to reduce this particular eye muscle syndrome. So, ladies and gentlemen, I think that's a wrap. I'm going to call it a day. I want to thank you so much for tuning in. I want you to be well, take care, and until next time, see ya.